Pyrocalm Control tablets contain the active ingredient omeprazole, which belong to a group of medicines called Proton Pump Inhibitors. They work by reducing the amount of acid the stomach produces. The tablets release the omeprazole in the intestine, where it is absorbed by the body to relieve symptoms. Pyrocalm Control Omeprazole 20 mg tablets are not intended to bring immediate relief. It may be necessary to take the tablets for 2 to 3 consecutive days to fully relieve symptoms. What is reflux? Reflux is a backflow of acid from the stomach into the gullet food pipe, which can cause it to become inflamed and painful. Sufferers may experience a burning sensation in the chest, headburn, and/or a sour taste in the mouth, acid regurgitation. The main causes for reflux are food and drink, including coffee, alcohol, chocolate, fatty, spicy foods, being overweight, smoking, pregnancy, stress, anxiety. Some medicines, such as anti-inflammatory painkillers, ibuprofen, hypotonia, where part of the stomach moves up into the chest. How to use? The recommended dose is 120 mg tablets once a day for up to 14 days. Contact a doctor if you are not free from symptoms after this period. It might be necessary to take the tablets for 2 to 3 consecutive days to achieve improvement of symptoms. Do not take more than the recommended dose, 120 mg tablets a day, even if you don't feel an improvement immediately. When your reflux symptoms have gone completely, you should stop taking this medicine. Taking Pyrocalm Control tablets. It is recommended that you take your tablets in the morning. You can take your tablets with food or an empty stomach. Swallow your tablets well with half a glass of water. Do not chew or crush the tablets. This is because the tablets are coated with an enteric coating, which stops the medicine from being broken down by the acid in your stomach. These tablets release the active ingredient in the intestine, where it is absorbed by the body to give an effect. Contraindications. Do not use Pyrocalm Control if you are allergic to omeprazole or any other ingredients of this medicine. Are allergic to medicines containing other proton pump inhibitors, pantoprazole, lansoprazole, rabeprazole, or esomeprazole, are taking medicine containing alphanavir used to treat HIV infection. Warnings. Warnings. Contains lactose. Do not exceed the started dose. If your symptoms do worsen or do not improve after taking this medicine for 14 days, contact your doctor. Pyrocalm Control side effects. Like all medicines, Pyrocalm Control can cause side effects, although not everybody gets them. Some of the side effects include common, may affect up to 1 in 10 people, headache, effects on your stomach or gut, diarrhea, stomachache, constipation, wind, flatulence, feeling sick, nausea or being sick, vomiting, benign growth, polyps in the stomach. Uncommon, may affect up to 1 in 100 people. Swelling of the feet and ankles, disturbed sleep, insomnia, feeling sleepy, dizziness, tingling feelings such as pins and needles, spinning feeling, vertigo, increased liver enzymes shown in blood tests that check how the liver is working, skin rash, lumpy rash, hives, and itchy skin, generally feeling unwell and lack energy.